Ever gone down one of those health-related Google rabbit holes?
Hmm.
One minute you've got a little twinge and the next you're convinced it's something awful.
Yeah, we've all been there. But it gets really interesting when we look at how this plays out for people with autism.
And that's exactly what we're diving into today, the
Yeah.
link between autism and hypochondria.
It is fascinating, actually.
Yeah.
You'd think they're totally separate things, but there are these intriguing connections.
Right, and we're not just talking about everyday worries here. You pulled some research on this, so let's really break it down for our listeners. Why might folks with autism experience this kind of health anxiety differently, and what can we actually do about it?
Okay, so first, we got to be clear about what we mean by hypochondria, or as it's now called, illness anxiety disorder. It's not just being a worrier. It's this really intense preoccupation with having a serious illness, even when the evidence just isn't there. It really takes over your thoughts.
So, like, occasionally thinking, oh no, a headache must be a brain tumor. That's not necessarily hypochondria.
Right. We all have those fleeting thoughts. But with hypochondria, that worry becomes a major focus, right? It starts impacting your daily life, your relationships, even work. And studies are showing this is way more common among autistic individuals.
Okay, so how much more common are we talking about?
Well, one study in the Journal of Autism and Developmental Disorders found that almost 30% of folks with autism experience significant health anxiety. Compare that to the general population, where it's more like 4–6%. Big difference.
Wow, that's huge. So, knowing that this is a key concern for many listening, why is there this connection? What's going on beneath the surface?
Well, a few things seem to be at play. One major factor is sensory sensitivity. The world can feel much more intense for someone with autism. They process sensory input differently, so even subtle sensations can get magnified.
So, an itch that someone else might barely notice could feel really intense, even worrisome if you're on the autism spectrum.
Exactly. And when your brain's constantly hit with these heightened sensations, well, it's easy to misinterpret them. It's easy to start thinking something's really wrong, even when it's not. Imagine feeling that day in and day out, the cycle of worry would be hard to break.
That makes a lot of sense. Are there other ways that autistic individuals might process health information differently? I mean, aside from the sensory aspect?
Yeah, definitely. Many autistic people are amazing at concrete thinking, but abstract concepts can be tougher. And illness, by its very nature, is kind of abstract, right? Symptoms are often vague, hard to pin down.
So you're saying someone who thrives on concrete information might struggle more to rationalize those symptoms compared to someone who's more comfortable with ambiguity.
Exactly. Think about something like stomach aches, right?
Yeah.
Super common, but the cause can be really hard to pin down. That lack of a concrete explanation can be incredibly anxiety-provoking for someone who needs that clear-cut answer.
That's fascinating.
And we haven't even touched on the importance of routine and predictability, something we know is really important for many autistic individuals. Health concerns throw a wrench in that sense of control.
Right. It's like that feeling when you have your whole week planned out perfectly, then bam, something unexpected happens and throws everything off. Now imagine that, but with your health, no wonder health anxiety can take hold.
And we're not talking about just a little inconvenience here. This stuff can have a real impact on someone's life.
Right. And it's not just anecdotal either. There's research to back that up.
Oh, absolutely. One study, I think it was from 2019, found that 40%, a full 40% of adolescents with autism worried about their health every single day,
Wow.
compared to just 10% of neurotypical teens. So yeah, we're talking about a significantly higher level of anxiety here.
It's a big deal. And hearing all this, it makes you wonder, what can people actually do about it? Like, is there any way to manage this kind of intense health anxiety?
Well, that's the good news. There really are some effective strategies out there. One of the most promising ones is cognitive behavioral therapy, CBT.
Okay, I've heard of CBT, but for our listeners who might not be as familiar, could you break that down a bit? How would it help someone with hypochondria specifically?
Sure. So CBT, it basically focuses on how your thoughts, your feelings, and your behaviors, how those are all connected, right? So with hypochondria, the therapist trained in CBT, they work with you to identify those negative thought patterns that are kind of fueling the anxiety. And then it's about learning to challenge those thoughts, reframe them.
So instead of someone just telling you, don't worry, which never helps, CBT actually gives you tools to change how you react.
Exactly. Like one technique is called cognitive restructuring. It's about learning to identify those unhelpful thoughts, challenge them, and actually change them. So, for example, someone always jumps to the worst-case scenario when they get a headache.
Right, it must be a brain tumor every time.
Exactly. CBT would help them question that thought, right? Look for other more realistic explanations, and then develop some healthier coping mechanisms.
Which has got to be so much more helpful than just being told it's all in your head.
Right. It's about giving people the power to understand their anxiety, to manage it, not just try to wish it away. And along with CBT, mindfulness practices can be incredibly powerful too.
Yeah, I can see how that would be helpful. But how do you even apply mindfulness to something like health anxiety?
Well, mindfulness is all about being present, right here, right now, without judgment. So instead of getting carried away by all those what if thoughts about getting sick, mindfulness techniques can kind of ground you in the present moment.
Okay, so what does that look like in action? Can you give us an example?
Sure, imagine you're starting to feel that familiar twinge of anxiety about your health. Instead of letting those thoughts spiral, you use a mindfulness technique. Like maybe you focus on your breath. Pay attention to the feeling of each inhale and exhale. That shift in focus, even if it's just for a few moments, it can really help calm those racing thoughts.
That's really helpful. It makes mindfulness seem a lot more doable, What else can be helpful here? We touched on the power of knowledge a bit earlier.
Oh yeah, knowledge is huge. And I'm talking about education for both the person experiencing these anxieties and their support system. Because the more you understand about hypochondria, about why it might be more common with autism, and about the effective treatments available, the less scary it becomes.
It's about taking away that stigma and giving people the information they need to ask for help.
Exactly. And speaking of help, regular medical care can be really important too. Now, it's not a cure for hypochondria, but having a doctor who really understands your concerns, that can be so reassuring. It helps establish that baseline of health, and it lets you know you're being heard.
It's about finding that balance, isn't it? Like trusting your gut when something feels off, but also having those tools to handle the anxiety so it doesn't take over.
Yeah, absolutely. And it's a journey, right? Figuring out what works best for you. But the important thing is that there are things you can do. There is support out there.
This has been a really eye-opening deep dive. For our listeners out there, especially those resonating with this, what's that one key takeaway you want them to remember?
Knowledge really is power. The more we learn about these complex topics, the better we can advocate for ourselves, for our loved ones. If you're struggling with this, with health anxiety, especially within the context of autism, you are not alone. There are real evidence-based strategies that can help.
I love that. You are not alone. And on that note, we've reached the end of our deep dive for today. Listener, we hope you found this exploration as fascinating as we did. Keep diving deep, keep asking those questions, and until next time, take care.